Hello everyone, my name is Deepa Bajetha and I am working as an associate professor in IIMT College of Pharmacy. Today I am going to discuss about topic thyroid. So the objectives I will cover in this slide. First one is thyroid gland, functions of thyroid gland, disorders of thyroid and causes of thyroid disorders, sign and symptoms of thyroid disorders, thyroid preparations and antithyroid drugs. So first is thyroid gland. What is thyroid or what is thyroid gland? Thyroid is small butterfly shaped gland located at the front of your neck under your skin. It is a part of your endocrine system and controls many of your body important functions by producing and releasing certain hormones. Your thyroid is main job is to control the speed of your metabolism or metabolic rate, which is the process of how your body transforms the food you consume into energy. All of the cells in your body need energy to function. When your thyroid is not working properly, it can impact your entire body. So the thyroid gland is butterfly shaped. You can see this shape in this diagram that sits low on the front of the neck. Your thyroid lies below your Adam's apple along the front of the windpipe. The thyroid has two lobes connected by the bridge in the middle. Each lobe is about 5 centimeter long, 3 centimeter wide, and 2 centimeter thick, with the isthmus about 1.25 centimeter in length. The lobes are asymmetrical. The lobes are asymmetrical with the right lobe usually larger. The gland is usually larger in women. When the thyroid is its normal size, you can't feel it. Brownish red in color, the thyroid is rich with blood vessels. Nerves important for voice quality also pass through the thyroid. So next is thyroid's hormones and their functions. The thyroid secretes several hormones collectively called thyroid hormones. So first one is thyroxine and the another name of this hormone is triiodothyronine and tetraiodothyronine, that is T4. So follicular cell secretes thyroxine, which contains 4 atoms of the iodine to form tetraiodothyroxine T4, and the follicular cells also secretes triiodothyroxine, in which 3 atoms of iodine is present. T3 and T4 collectively known as thyroid hormones. So the functions of these hormones is first, it increase basal metabolism rate by increasing O2 consumption in most tissues except lungs, brain, testes, and retina. Essential for growth of the skeletal in children, thyroxine is regulated by thyroid stimulating hormone TSH from pituitary gland. It also affects on the lipid metabolism. It is regulated by thyroid stimulating hormone. At first, T4 is synthesized, which is converted to T3. T3 is 5 times more potent than T4. Sorry. Deficiency of thyroxine is goiter and hypothyroidism, and excess of thyroxine in the body, excess of thyroid hormone in the body cause thyrotoxicosis and hyperthyroidism. So next hormone is calcitonin. This calcitonin is secreted from the parafollicular cells. Calcitonin is a polypeptide hormone. The secretion of calcitonin is regulated by the concentration of the calcium in blood, but not by feedback mechanism of pituitary gland. So the functions of calcitonin is it basically lowers the calcium level in the blood, antagonistic to the parathyroid hormone. It acts directly on osteoclast to reduce the remodeling of bone and increase reabsorption of the calcium. It increases the movement of calcium ion from the blood to bone. So, what is the endocrine system? In this endocrine system is a network of several glands that cause and secrete hormones. A gland is an organ that makes one or more substance such as hormones, digestive juices, sweat or tears. Endocrine glands release hormones directly into the bloodstream. Hormones are chemicals that coordinate different functions in your body by carrying message through your blood to your organs. Skin, muscles, and other tissues. These signals tell your body what to do and when to do it. The following organs and glands make up your endocrine system. First is hypothalamus, pituitary gland, thyroid, parathyroid glands, adrenal glands, pineal gland, pancreas, ovaries, and testes. The functions of thyroid gland, the main hormone is thyroxine. T4, tetraiodothyronine. Thyroid hormones act throughout the body, influencing metabolism, growth, and development, and body temperature. During infancy and the childhood, adequate thyroid hormone is crucial for the brain development of the fetus. So it plays a role in the controlling heart, muscle, and digestive function and bone maintenance. Its correct functioning depends on good supply of iodine from the diet. So, what is the disorders? The thyroid disorder can range from small, harmless goiter that needs no treatment to life-threatening cancer. The most common thyroid problems involve abnormal production of thyroid hormones. Too much thyroid hormones released in a condition known as hyperthyroidism. Insufficient hormone production leads to hypothyroidism. So first we will explain hyperthyroidism. The symptoms of this hyperthyroidism are tremors, nervousness, fast heart rate, fatigue, increased sweating, concentration problems, feeling mentally foggy, unintentional weight loss, more bowel movements, shorter or lighter menstrual periods, palpitation and irritability. These are the symptoms of hyperthyroidism. First, causes of hyperthyroidism. The first cause is Graves' disease, the production of too much thyroid hormone. If the production of too much thyroid hormone in the body, it causes Graves' disease. This is the autoimmune disorder that can cause hyperthyroidism or overactive thyroid. The thyroid is small butterfly shaped gland in the front of your neck. Thyroid hormone control the way your body uses energy. So they affect every organ in your body, even the way your heart beats. So next disorder, the next cause is toxic adenomas. Sorry. Nodules develop in the thyroid gland and begin to secrete thyroid hormones, upsetting the body's chemical balance. Some goiters may contain several of these nodules. So, toxic adenomas is an autonomously functioning thyroid module which causes nodules hyperthyroidism. These nodules are most always begin. Some autonomous nodules cause only subclinical hyperthyroidism, which suppress thyroid stimulating hormone. level and normal concentration of free thyroid hormones. So next cause of this hyperthyroidism is subacute thyroiditis, inflammation of the thyroid that causes the gland to leak excess of hormones, or it is uncommon condition thought to be caused by viral infection of the thyroid gland. The condition often occurs after a viral infection, the upper respiratory tract. Mumps virus, influenza virus, and the other respiratory virus have been found to cause subacute thyroiditis. So, what is mumps virus? Mumps virus is a viral infection that affects the salivary glands that easily preventable by the vaccine. So, pituitary gland malfunctions or cancerous growth in the thyroid gland is, although rare, hyperthyroidism can also develop from these causes. So pituitary disorders occurs when the pituitary gland makes too much or too little of particular hormones. Most often these disorders are caused by the pituitary tumor. Most pituitary tumors are non-cancerous. You can see here with the help of diagram, this is Gravius disease, eyelids, bulging eyes, redness, and toxic adenomas, subacute thyroiditis. So what is the symptoms of the hyperthyroidism disorder? So first one symptom is lack of energy in the body, fatigue, weight gain, feeling cold, dry skin and hair, constipation, poor concentration of feeling mentally foggy, fluid retention, muscle and joint ache, depression, prolonged or excessive menstrual bleeding in women. So first cause of hyperthyroidism is Hashimoto's thyroiditis. It is the autoimmune disorder. The body attacks thyroid tissue. The tissue eventually dies and stop producing hormones. In case of hyperthyroid, too much thyroid hormones released in our body, and in case of hypothyroid, less amount of thyroid hormone released in our body. So Hashimoto's disease is an autoimmune disorder. The immune system creates antibodies that attacks thyroid cells if they were bacteria, virus, or some other foreign body. The immune system wrongly enlists disease fighting agents that damage cells and lead to cell death. So next is removal of the thyroid gland. The thyroid may have been surgically removed or chemically destroyed. Next is exposure to excessive amounts of iodide. So the removal of thyroid gland or also called thyroidectomy is a surgical removal of the all part of the thyroid gland which is located in the front of the neck. So thyroid gland releases thyroid hormone which controls many critical functions of the body. So next is exposure to excessive amounts of iodine. So in case cold and sinus medicines, the heart medicines and amiodarone or certain contrast dyes given before some x-rays may expose you too much iodine. Next is lithium. This drug has also been implicated as a cause of hypothyroidism. Avoiding certain foods like soy may be helpful to people with hyperthyroidism. Untreated for long periods of time, hyperthyroidism can bring on myasthenia, coma, a rare but potentially fatal conditions that requires So hypothyroidism poses a special danger to newborns and infants. A lack of thyroid hormones in the system at an early age can lead to the development of cretinism, that is mental retardation, and dwarfism, that is stunt growth. So next is thyroid preparation, how we can prevent this hyperthyroidism or hypothyroidism. They are the number of thyroid preparation we can use as a drug. So first is, what is thyroid preparations? The thyroid is the gland in your neck associated with the metabolism. So the thyroid, the process by which your body makes use of energy, autoimmune thyroid disease is common in lupus. Lupus means inflammation of skin. It is believed that about 6% of the people with lupus have hypothyroidism, that is underactive thyroid, and about 2% have hyperthyroidism, that is overactive thyroid. A thyroid gland that is functioning improperly can affect the functions of organs such as brain, heart, kidneys, liver, and skin. Hypothyroidism can cause weight gain, fatigue, depression, kidneys, liver, and skin. Hypothyroidism can cause dry hair and skin. Hyperthyroidism can cause weight loss, heart palpitation, tremors, heart intolerance, and eventually lead to osteoporosis, in which bones become weak and brittle. Treatment for both hyperthyroidism or hypo, that is underactive or overactive thyroid, involves getting your body's metabolism back to normal. So powdered thyroid gland, officially termed as thyroid, obtained from domesticated animals, and the pure hormones L-thyroxine and L-triiodothyronine, or the other name of this L-triiodothyronine is liothyronine. Both as sodium salts are thyroid agents used as a replacement therapy in hypothyroidism to correct thyroid deficiency. The official drugs which we use in thyroid preparations are L-liothyronine sodium and Thyroxine Sodium. So first one is Thyroxine Sodium. The diagram of this L-thyrionine, the levothyroxine occurs a light yellow to buff colored powder fine fine, slightly colored crystalline powder. It is stored in tightly closed, light resistant containers. It is readily absorbed from the gastrointestinal tract. It is eliminated slowly from the body and has half-life of 6 to 7 days. The use of thyroxine sodium is primarily indicated for the treatment of hypothyroidism disorder. The treatment is usually long term, as it is replacing thyroid hormone the body is not producing. Hypothyroidism is a case in which body is not enough produce thyroid hormone, so we can use this thyroid preparation as a replacement. The doses is usually adjusted according to response and the blood test results. Next is L-liothyronine sodium. Liothyronine sodium is a synthetic version of one of the two hormones made by the thyroid gland, that is triiodothyronine. So use of this L-thyrine sodium is for the treatment of hypothyroidism. Both the drugs we can use for the hypothyroidism in adults as well as in children. Prolonged hypothyroidism can result in a condition called myasthenia, in which patients develop swollen lips, thickened nose, and unusual deposits of material in the skin that are dry and waxy. The diagram of L-thiorenin drug, in which three iodines are present in the structure. So next is anti-thyroid drugs. Anti means against. So anti-thyroid drugs are mainly compounds that interfere with the body's production of thyroid hormone, thereby reducing symptoms of hyperthyroidism. These drugs are used to prevent the excess production of thyroid hormone in our body. So we can, with the help of these anti-thyroid drugs, we can prevent the disorder of hypothyroidism. So the classification of anti-thyroid drug, the drugs involved in this, first is thiourylin derivatives. In thiourylin derivatives, first is thiouracil, and the drug used in this methyl thiouracil, propyl thiouracil, imidazoles, methimazole, carbimazoles. Second is ionic inhibitors, and last one is radioactive iodine. So first one is thiourylin derivatives. An early observation was made that rabbits fed on a diet composed largely of cabbage developed goiter, a condition in which the thyroid gland is enlarged as the hormone synthesis is inhibited. It was found that cabbage leaves contain precursor of thiocyanate ions. Later, it was observed that two pure compounds, sulfaguanidine and phenylthioperia, also produce goiter. So, this is the structures of sulfaguanidine and phenylthiourea. These are the thiourylin derivatives. Next is thiouracils. The two drugs methylthiouracil and propylthiouracil. In methylthiouracil, we can use methyl group, and propylthiouracil, we can use CCH2, CH3 groups, are used as anti-thyroid drugs. These drugs have thiourylin system in their structures. Imidazole derivatives. The imidazole derivatives are also used as antithyroid drugs. They include methimazole and carbimazole. These drugs bind to thyroid peroxidase and prevent oxidation of iodine, iodotyrosyl residue, thereby inhibit iodination of tyrosine residue in thyroglobulin. These are the structures of methimazoles and carbimazole. Next is ionic inhibitors. Ionic inhibitors are the substance which block the iodine transport mechanism. The affective species are themselves anion, resemble in their hydrated ionic size to iodide ions. Thus, triiodothyronine and tetraiodothyronine cannot be synthesized, but their use in the therapeutics is abundant because of the toxicity. The example of the ionic inhibitors are thiocyanates. It is a product of enzymatic hydrolysis of certain plant glycosides, perchlorate ion, and nitrates. Next and last one is radioactive iodine. The stable isotope of iodine is 127 iodine. The active isotopes of the iodine of the medical importance are 131 iodine. Physical half-life of this is 8 days, most commonly used. Next is 123 iodine. Physical half-life is 13 hours, only rarely used For the diagnostically, 125 radioactive iodine physically half-life is 60 days, and 131 iodine emits X-rays as well as beta particles. So the use of radioactive iodine, the most common indication in hyperthyroidism due to Graves' disease or toxic nodule goiter. Thank you.